There's an increasing recognition across the country that we need to train more people in the settings where they will provide the predominance of their clinical experience.
Access to care was a huge emphasis, and with the Affordable Care Act and making sure people had this access to care and some type of insurance card in their pocket. We've had that for a while, and yet the quality of their health care has not improved. So a physician assistant needs to be an integral part of that piece of what's missing.
So having students in our clinics, at least in my personal experience in training students, I've learned that if we do take a little bit of time on their front end of their rotation, their time with us, then it does start to pay dividends in a relatively short amount of time. And it becomes to be a help for the patients because they can immediately start seeing a patient instead of the patient waiting for the next 10, 15 minutes to see me. The students got started with them and the patients like that.
I enjoy the time to have a student here. I would say that it's one of the more helpful things that I do because it is what challenges my medicine. Every day practicing medicine here is a challenge. Nothing is the same, one patient after another. But you bring a student in and they'll ask the question. And the number of times I have to look at them and be like, no idea, let's look it up, has been incredible. You also have this fresh breath of air. These students are eager to learn, and it's wonderful to share with them the desire. But I think that's the biggest thing that I hope that I give to a student is to see what we manage here really shows you that a PA is valuable anywhere.
Chris is a great preceptor, and John and Dr. Moreland and all of the docs over there have been guiding me and teaching me, and I feel like I make contributions too because sometimes I like pick up on things that maybe the patient wasn't necessarily being seen for, but you know, then we get it addressed, and that makes me feel like I'm doing something.
He might give me a little background on the patient, but then when I come out, he really kind of quizzes me and pushes me to come up with a good differential, why I'm thinking the way I am thinking, and it just kind of helps me think along those lines. So I can tell as I progress throughout my clinical year, I'm thinking more when I'm asking my questions too with the patients, you know, do I need to know this because of this differential, or do I not need to know it, and it's kind of irrelevant information.
Seeing a student and seeing how excited we are, I think makes the clinicians, the PAs, and the doctors we work with more excited about their jobs because they're kind of imparting this wisdom, and so it's a back and forth relationship, so I really like that.
When I came on, there was a physician, Dr. Randi Abramson, and a family nurse practitioner who worked here as well. So there was a lot of collaborating between the three of us. So we want to give that chance to students and encourage students to go into primary care. I think that it also helps us as providers to have students because they ask you questions. They make you stay on top of your game. I don't see them as a burden. Yes, the teaching part might take a little bit more time, but it makes you a better clinician in the end.
So Jen started here as a student, as she said, and then we were looking to expand. And after working with someone, sometimes you get a sense of, is this a good fit? I have a lot of responsibilities, and I know that she's another set of eyes that are on all of our patients, and I think that's what helps make a difference.
The relationship is fantastic, and the reason why it's so fantastic is because when the PAs come here for training, not only they have other PAs who are experienced and been working here for a long time, they also have the PAs who are starting, so they get to know those folks as well. Patients get to fall in love with them. Who's that person that was in the room with the doctor, and I really like that guy, or I really like that doctora, their doctor, you know, they call them doctoras. And so they fall in love with the patients who also fall in love with them, and they get to know them, they get very excited.
These students have a chance to get hands-on and learn. Besides for them, the great opportunity is for them. I think it's great for people too, to you know, get to meet with these students too. It's a two-way thing. I really enjoy meeting them, frankly. I give them a hard time, but you know what? I really enjoyed it.
We believe that health centers are trying to address not only what occurs inside the health center, but also within the community itself. How do you meet those needs? It's a team approach. And when you look at the team approach, that team has a variety of members. It is very obvious that PAs are essential members of that team.